one of the big things that we look at is anytime you have chronic pain, there's always going to be gut issues with it. And the gut issues, and they need to be resolved, and detoxification needs to happen simultaneously. Don't try to just get all these gains in the gym when you're pushing through pain. That's not what I'm saying. It's like, let's get the muscles healthy, and then the muscles will actually start to grow and regain their previous version of strength. So you think of someone who's been in pain for 30 years, and it's like, what can we do? Well, cord plasma was a big thing. Detoxing all the blood, pulling out all those pro-inflammatory cytokines. I also found that things like gluten, sugar, that turns off the stem cell signaling. And so once we did that, then we went up to 80%. And so we have that coupled with peptides, and now we've seen more like a 95% success rate. So really happy about that.
All right, welcome everybody to the Health Accelerator Challenges. This is Regan Archibald here, and I'm joined with none other than Regan Archibald. Regan, how you doing?
Doing great. Yeah, fun day, and fun time. Some of you, you've been in the office this week, and we even had friends from Switzerland and France, Monaco. They were in town, and they look so good. Everyone in the office, because they haven't been in for about a year. But when I was over in Monaco, doing the longevity retreat for them, I already saw them, so I knew the transformation. But Misha was like, I didn't even recognize him. I mean, they look so good, and it's been really fun. But yeah, it's been a great week. Having everyone out. And by the way, one of our good friends, clients, Chris Voss, his movie just he's got it on Amazon, Tactical Empathy. So watch that. It's brilliant. Give him a 5-star review. And then also Garrett Gunderson, who's a good friend and client. His movie's on Amazon called The American Ream. And so both of these humans have made such an impact on my life and millions of people's lives. So go check it out. You'll laugh a lot with Garrett. And if you live in Utah, September 6th, Garrett's doing a comedy crunch. We're having a retreat with Garrett. And then, so Kate, I don't know if you saw that, but we'll get tickets. We got to go. That would be great.
Yeah, I saw that. And both Tactical Empathy, amazing show. Yeah, definitely check it out on Amazon. And then it's also American Ream's also on Amazon. So Chris Voss's movie, awesome, Tactical Empathy, and then Garrett Gunderson's hilarious. It's that was so funny. American Ream. So yeah, really cool stuff. We got some amazing clients.
What's that?
We just got some really cool people.
Just like all of you. It's just it's so awesome to see.
Yeah. What do we get to dive into today? I guess what I missed last week. I had some stuff going on. So what was the challenge?
Well, the challenge was we talked about humanin and mitochondrial peptides, and so it's just do some exercise to boost your mitochondria was a challenge. So how many of you got into that? I know we sent out some of the research articles on humanin and what a cool peptide it is. Hopefully you guys got that, but you'll see it in the show notes coming up. And then today we're going to talk about, we're just going to go through some case studies and talk about some of the thinking that goes behind our program. So we get asked this a lot, and we had a huge breakthrough this week. I guess it was last week where we started, we were writing out the protocols and explaining it more. So I'm going to share with you guys some of the beautiful things that peptides can do for some of the toughest conditions. So Should we jump in and we can talk some about that?
Let's do it.
Yeah. So um, here's some things that we can cover today. So how many of you, first of all, like maybe you've got some type of pain? Anyone experience pain? And then with the pain over time, we found that you'll see like some gut issues that show up. And so what I'm going to share with you guys today is kind of I'll show you the thinking process behind getting the right tests and then eradicating the pain and what to look for. And hopefully it's not too technical, but I think at the end of this, my goal is for you to just have a little better knowledge of what can happen in your own health journey once you start diving into some of the basics. And I'll share with you how it looks. So let's jump into a recovery protocol. So this is a client. Let me share the screen here for those of you who like visuals. Okay, so this is helping one of our clients who had hip issues, and we'll be talking about some of the things that she's been dealing with. But first of all, if you have an injury and you're looking for a quick way to resolve it, you want to just kind of dive in and say, well, where did it come from? And then initiate some healing response. And I got to do a different one because I don't want to. I need to make sure that this is all.
All good.
I don't want to have any HIPAA. And I realize like maybe with her first name there might be. Let me pull up mine. So I'll pull up some hypotheticals. How about that? Okay, here we go. So this one's interesting. This one, sorry everybody, this will be much safer, but it still falls into the pain. So this is a client who's got chronic neck pain for over 30 years. And it's like, how can we get on top of this? And how can we actually get to the root of it? Because I think what's missing in medicine in so many cases is the fact that we run up against the wall of not having the right answers. And so this client, she came to us and she's looking for answers to really mitigate what's happened in her life because of this chronic pain. And so as we plug things in, we actually have a really solid strategy that many of you can hopefully take some of these things and utilize it in your own day-to-day life. But one of the big things that we look at is anytime you have chronic pain, there's always going to be gut issues with it. And the gut issues, and they need to be resolved, and detoxification needs to happen simultaneously. And then what happens when you have pain? If any of you have noticed, you start craving sugar and you start, having different, desires for things that aren't really healthy to mitigate some of the damage of the pain and to kind of turn it off and numb it. And so you'll see in this protocol kind of interesting because it will show exactly the peptides we're using to bring that down. And these are some of the peptides you may actually be on. But yeah, chronic neck pain, sugar cravings, low protein intake, high white blood cells, so possible infections, heavy metal toxicity, hormonal imbalance, low sleep quality, high stress, adrenal overdrive. Goals: relieve pain, gain muscle mass, manage stress, improve nutrition, hormone, address any toxicities. And so we put together her reset, recharge, and restore. Each phase being approximately 60 days with the focus on pain relief, muscle gain, detoxification, hormone, and stress management. So Kate, if someone has pain, why would we want them to have muscle mass? Why would that be a goal?
Well, I'd imagine muscle is going to help with the body recovering and being able to handle different traumas or things. Um, yeah, what's the correlation? So we want them to put on more muscle mass if they have pain. Is that what you're saying?
Yeah. Well, because when you can build muscle mass, that means you're actually healing the connective tissue, the tissues in the body. And so sometimes
Yeah.
muscles get dehydrated. And so if you guys have like a lot of strain in your body and we had Ashley Wright on talking about posture a couple weeks ago. And by the way, Kate, maybe you could plug in her email so that I'd love for you guys to get an assessment from her. But that those are the things where your muscles, when they get in pain and they get hypertonic, the muscles get really dehydrated. And especially those of you who are on like hormone replacement, you do need more hydration than if you're not on it. So don't be alarmed if you notice like more muscle cramping when you get on some like testosterone specifically. But you'll know that if you get stronger, usually we'll see pain come down, and but you don't push over, don't try to just get all these gains in the gym when you're pushing through pain. That's not what I'm saying. It's like, let's get the muscles healthy, and then the muscles will actually start to grow and regain their previous version of strength. So that's it, Kate. So it's probably simpler than you probably thought it was. But yeah, so we'll do carotid artery, metabolomics, regular blood tests. Stem cells is going to be a big part of the treatment. And then also, for those of you who have any kind of pain in your body right now, sometimes even injecting peptides into the areas that you have pain, and especially if it's in the back, it's going to be hard. So get your partner to help you out. That can make a big difference. And so that's one of the parts of the protocol is inject the recovery blend, which is the BPC 157, thymosin beta 4, or TB 500, KPB, and GHK copper. And what that will do is help the tissue regenerate. It will provide more angiogenic properties so that you get better blood supply to the muscle, and then the muscle will lengthen again, and the neck should have some nice relief. So yeah, these are some things you can do at home. So the big thing in the first 60 days. So you think of someone who's been in pain for 30 days, or for 30 years. And it's like, what can we do? Well, cord plasma was a big thing. Detoxing all the blood, pulling out all those pro-inflammatory cytokines, tesofensin, because if you're eating sugar, and I don't know if any of you have experienced this, but if you have pain, go eat a bunch of sugar and tell me what happens to your pain levels. And in most cases, that blood sugar spike triggers more inflammation, and then that drives more of the pain response. Have you ever noticed that, Cade? Or have you ever actually eaten sugar in your life, or have you pretty much
I
been?
I don't believe in sugar. I've never touched it ever. No, it's crazy how your joints feel. Especially I noticed it when like I would when I started eating really clean and really well, it was like, oh, your joints just feel better. And then, if I would eat some sugar or just like you have that big cheat day or something like that. I haven't done that, like knock on wood, I haven't done that for a while. Been a lot more disciplined since I've just like dialed things in. But I just remember my joints, like my knees would get achy when I'd run.
Yeah.
Um, yeah, it just seems like even when it's cold, like they would ache more. Kind of like it's almost like creating arthritis symptoms, just by having too much sugar.
Yeah. Oh, yep. And that's it. And that's what a lot of you, when you go on treating pain, make sure you fix the lifestyle with it. And especially one of the worst things that can happen is you get steroidal injections, and that the steroids actually increase your blood sugar. And they can actually, especially if you have diabetes, you got to be very careful because you can actually go into a diabetic coma. Your blood sugar can go so high and then drop down so low. But tesofensin, for those of you who have tried tesofensin, love to hear your thoughts on this one. It's actually one of my favorites because it's a nootropic. It works on serotonin, dopamine, and epinephrine pathways. Just amazing if you're trying to, not have the cravings all the time, but you don't want to be on a GLP-1, but you also like the benefits mentally. I mean, talk about mental clarity with this one. So tesofensin is phenomenal. We got on epitalin to start sleeping again with the GHK copper, because GHK copper will help heal wounds, anti-aging, but the collagen synthesis is what will help the connective tissue. And then once again, the BPC and those are for muscle repair, anti-inflammatory, just a really phenomenal protocol. On the supplement side, we actually got her on BPC, KPB, which is gut tides, to take orally, so that seals up the leaky gut. Because with chronic pain, you'll almost always see there's going to be intestinal permeability, and I mentioned this earlier. And so for those of you who've had chronic pain, you may be asking, like, well, why is that? Well, what happens is your body goes into the kind of the sympathetic or fight or flight response, and that turns off the parasympathetic response in your body. And so that parasympathetic response is the rest and digest. And then, especially if you take opiates, for example, what you'll see is those opiates can actually slow down your digestive system, and you start getting some pretty severe like infections over time. And if you're constipated, you're reabsorbing toxins and having inflammation. So it's really important with chronic pain, treat the gut, eradicate any infections, get rid of anything that would trigger more inflammation. And then one of the counterintuitive things is, if you do happen to have chronic pain, one of the worst things you can do is just not move at all, because movement is healing. And if you stop movement, then that's when the pain can start to build up in your body. We got our NeuroPro, so that's NAD, and this one's fun. NeuroPro is methylene blue. For those of you who have used this one, you probably notice your urine changes colors, but very phenomenal for getting your body out of that cell danger response. It activates the electron transport chain. It's a sirtuin activator, so it cleans up your DNA. And then the neuro NAD for the brain, because if you think about where pain comes from, we don't actually know, because you can have phantom limb syndrome and it's like you don't even have an arm, but it's in pain. And we've talked about this in the past. And it's kind of curious because in one of the studies, I think it was 2011 or 12, they took 300 people. Half of them had back pain, the other half didn't. And they did MRIs on the backs of these individuals. And what they found is that half of the individuals that had chronic back pain, their MRI results showed perfect, like they had no issues. And the other half had like degeneration and osteophytes and herniated discs. And then they took the group that didn't have any pain and they ran the MRIs, and the same thing. Half of them had like really messed up discs and they had degeneration and bone spurs, but they didn't have any symptoms. They had no back pain. And then the other half had nice looking back. So I mean, and I just illustrate that because pain, it causes atrophy in the brain. It's one of the biggest things that limits our quality of life. And it's also something that tends to get worse over time. And so pretty interesting. So that's one of the reasons why we activate the mitochondria, work on the brain. We did some detoxification with Cellcore, biotoxin binder. If you have any kind of mycotoxins, any mold, that's going to remove that. It helps with immune dysregulation. These are short chain and medium chain carbon molecules. The drainage activator. This one, Kate, do you take the drainage activator often?
Not often. No, it's probably been a couple months since I've kind of cycled off that.
Um, it's I would recommend you take it, especially when the fall comes, because you get allergies.
Yeah.
The drainage activator is like it's like five products in one, five cell core products that they put into one to open up the lymphs. There's not a lot of great things that I found for lymphatic drainage besides like dry brushing, jumping on trampolines, and but from a supplement perspective, it's amazing. So I would definitely try it.
Yeah, I'm starting to get a little bit of the sneezies this morning actually. I noticed it's like, oh man, it's fall's coming around. Got
Yeah.
falling in the air. So I gotta get some drainage activator. Nice.
Yeah, yeah. Let me know how it goes, but it's been very good, overall. So you want to make sure you're getting protein in. For those of you who, you guys know where we want you to eat about a gram of protein per pound of body weight, and that can be overwhelming. So just start with where you can. If you eat 50 grams and you're like, okay, I'm going to do 60, then get that down, and then add in from there. But the goal would be like getting 30 to 50 grams first thing in the morning, especially if you have chronic pain and if you're trying to fast. Sometimes fasting, it's a detoxification, and if you're doing a long-term fast, it's really good for pain. But if you're doing like too much time restricted eating, you can actually trigger a stress response and increase the pain even more. So, just kind of be cautious there. That's where, when you wake up, get some protein in your body, and then get rid of like gluten, bourbon, if you happen to like bourbon or alcohol, get rid of sugar, track your sleep, because that's how we can see, even if you're not noticing a diminishing of pain, if we start seeing that you're sleeping better, then we know your body's in a healing response, and then the pain will slowly start to come down. So if you notice your REM, you want to be REM about 2 hours, deep sleep about an hour and a half is like a pretty solid number. And so see how you're doing. And you can use like a Whoop or Oura Ring. I just happen to like my Garmin because it's from a fitness perspective and metrics. It's very nerdy. Stress management, that's a big one. So then we said, okay, let's move into the recharge phase. And this is where thymosin alpha 1, LL37. And if you guys want to learn about thymosin alpha 1, we have a whole podcast, where we released it. And so you guys can go and listen to that on Reasonable Health. And by the way, these are also, this will be on the podcast, and every hack we do publish it on YouTube and the podcast station, so you can listen to it if you miss these. But the thymosin alpha 1 and LL37 are really important because they're some of the most powerful peptides have been studied for thymosin alpha 1. I believe this was 1987 at the Albert Einstein School of Medicine. And they were studying the thymulins, and they found thymosin alpha 1, and they noticed that not only did it help remodulate the immune system, it's great for autoimmunity. It helps activate better white blood cell activation, so you can actually get rid of those lingering infections. So if you've had like chronic sinusitis or chronic coughs, the thymosin alpha 1 is actually really protective and activates your thymus gland. The LL37 is phenomenal because it's a cathelicidin. So, cathela means like universal, and then side means like destroyer. So it destroys the any kind of like infection in your body, but then it regenerates the damage that has been done. So if you have scar tissue that's built up, if you have like injuries from like COVID or any kind of like vaccine injuries, it can help heal the blood vessels. AOD 9604, this is good for stem cell promotion, fat loss, metabolic health, MOTS-c for the mitochondria, testosterone for growth hormone, muscle growth, cognitive function, and all these peptides have been studied extensively. But you want to think like, okay, well, if you've got pain and you're trying to like regenerate the body, that's where first of all, removing the interferences with thymosin alpha 1, LL37, and building up the immune system. But then with some of these growth hormone peptides and mitochondrial peptides, that's where your body starts to feel young and dynamic again. So, Kate, I've been talking a lot. Thoughts on this protocol? I mean, I get really excited because we have some very cool medicine that we practice. But what are your thoughts?
It is so cool. And I think just the dynamics, like we were working with one of our clients and friends on just talking about East West and kind of the concepts. And I thought just like how Eastern and Western and then how we bring it all together is so beautiful. And just these protocols are really, really cool, where you got like gut tides, some of the different peptides mixed with the cellular medicine, Chinese herbs and different supplements there. Like it's really cool. I get stoked about it as well. I just some of the things you're saying, I'm like, I don't know what that's doing, but all right, yes.
Um, well, good. And hopefully, if you guys have questions, plug them in. One of the things, we continue on the gut lining, but the SBI Protect, this is great. If you ever get like diarrhea, or you travel and you get traveler's diarrhea, loose stools, SBI Protect is amazing. It's lactoferrins. It's actually from like serum. It's the lactoferrins from serum, but it's actually one of the most protective things you can do for getting rid of toxins and supporting your immune system, but it helps with leaky gut. New Pep, also known as obaracetam. This is one of my favorite nootropics. Especially, man, if you want focus, if you want to be able to like get things done and stay on task, New Pep, it activates BDNF. It's part of the racetam. So if you take it with like choline, or make sure you eat eggs when you take it, consider taking like alpha GPC. Though that combination is strong. And then we move deeper into the detox pathways, and the VidRad CAM, that's like binding with all the chemicals, the HMET, those are heavy metals and environmental toxins. So really important for the liver, the kidneys. Calcium D-glucarate, that helps unconjugate hormones. Once again, really good for helping detox the body and optimize health. And then, some of the things that we suggested is like, keep your protein intake, high, make sure you're getting 25 grams of fiber per day. Cook your high fiber vegetables. You can get it from nuts, seeds, grains that are gluten-free. Awesome. And Diane, good to hear from you up there in Montana, which is the one that helps detoxify the body.
The VidRad.
Yeah, VidRad CAM, detoxify just of general chemicals and plastics. And HMET does some of the same, but it has a little more on the heavy metal side. For the lymphs, it's the drainage activator. Then we move into the phase 3. Do we have another question coming in? Ashley, I saw your hand raised. Yes, I don't know.
That was just a confirmation of yes, love that.
Oh, cool. Okay. So now we're like, okay, let's continue on the regenerative side. So you notice like we cycle peptides. You're on them for about 60 days on certain stacks. And then we transition you to new protocols and new stacks. And then sometimes we circle back around to work on those same pathways. And that's the beauty of some of the great pharmacies we use. Man, the breakthroughs in peptides and like even the last 6 months has been so exciting. And I know you guys, we've had these hacks on the new peptides, and I try not to overwhelm you, but you'll see a protocol with all the new ones maybe next time. But then we go back to the BPC, thymosin beta 4 or TB500, KPB, and GHK, and then tesofensin. And then this is also where we're going to introduce the retatrutide. And this is one of the new GLP-1s. And it will it's so effective. And Eli Lilly has it in like phase 3 clinical trials. So they're going to ruin it just like they ruin every other great thing on the planet. They'll have the dosing will be way too high. It'll be way too expensive. But right now, what we've seen is it's a GLP-1 agonist, it's a GIP, and it's a glucagon. So it's a energy generator and as a performance enhancement, but the weight loss in people who have like diabetes or obesity was more dramatic than that of the tirzepatide. And then they also found that the blood sugar stabilization was much more supportive than the other tirzepatide or semaglutide. So amazing.
Interesting. Hey, we had a question come in from Darlene. Should Selenk be taken morning or evening?
Darlene, I'm so glad you're on here, and it's so fun having you in the office last week. We had such a good group. It was so fun. The Selenk, in your case, most of the time, like afternoon, evening is great because it's works on the GABA pathways. But I would do it in the morning and the evening. I mean, do it like try it and see which one you like best. But in your case, what we're trying to do is just change some of that neurochemistry in the brain. And so I would do it both. And it's a very safe peptide. I mean, Selenk, you could do like the whole bottle in one day, and we have yet to see an adverse reaction from it.
Not that we're advocating for that, but
No. Yeah, thank you. We kind of moved on this one on the gut. So we started the reinoculation with the probiospores. So a lot of probiotics, they just don't make it into the large intestine. They're destroyed, unfortunately, before they land. So this is where like the spores, that's a way you can activate some really healthy growth of your good, healthy gut biome. And then the other new thing we put her on is apigenin and glutastat. And apigenin is it's actually this flavonoid that comes from chamomile, and it clears out senescent cells. So it dumps out all the zombie cells in your body, but it helps with sleep, relaxation, enhances brain health. And then the glutastat is it's glutathione, which is 3 peptides, but it also has for those of you who've tried glutastat, and I know several of you who are at the event, you tried it as well, and it's got some really powerful properties because there's oregano, there's thyme, there's oxytocin. And so it's a fun one. Do you like the glutastat, Kate? Because I know you like the strong nasal sprays. Like, I mean, you go crazy with like Zen.
Oh yeah. No, I love glutastat. It just like clears the sinuses. You feel really alert and awake, and then that's great. I really like it like during cold season. I like doing that a lot. Just keep antioxidants in there to clear out the sinuses.
Yeah, love it. So glutastat was there. And so, as we go on, balancing hormones, drainage activator, the CT enzyme. But, the big thing that we see is, what used to take us a lot longer to get people out of pain. We've seen with the introduction of stem cell therapy over a decade ago, and then you start coupling that with the right lifestyle, the detoxification, and then you throw peptides in there. We've not seen results like this. I mean, it's unprecedented. We went from having about a 50% success rate in our original stem cells, and it was challenging because it's an investment, but then also it's like I didn't want to risk my reputation. I was like, this is like it's not predictable enough. So when I did the research, I realized, oh, we have to get rid of all the interferences. So fix blood sugar, get rid of toxins, increase the nutritional levels in the body dramatically, not just the nutritional levels for like a Ford Focus, but for a Ford Raptor, to use the analogy that Dan gave us at Go Wellness. But and then I also found that like things like gluten, sugar, that turns off the stem cell signaling. And so once we did that, then we went up to 80%. And then what we realized is, oh, now we have a new lab and we can get about 40 to 50 million stem cells per vial, which is phenomenal. And so we have that coupled with peptides, and now we've seen more like a 95% success rate. So really happy about that. This is an overview of everything that is going on in that program. But if you think about the breakthroughs and the opportunities in healthcare today, I mean, it's never been better. But it's also never been worse. I don't know if you guys have noticed that, but it's also like the whole medical system is just like it's getting more and more fragmented. It's getting more and more antiquated. It's getting far more expensive, but we don't get anything in exchange for that. Our friends from Europe, Cade, we went to dinner with them the last 2 nights, and it's very interesting because they have to come to the United States. They're like, yeah, we tell our friends in Europe, like, we go see, this guy in Utah and his team, and they're like, Utah, why Utah? And they're like, well, that's where the best medicine is. And then I asked them about the healthcare, like in Switzerland or France, and it's good healthcare, but it's still like treating disease. And right now in our society, I think that's the last thing we need, is to focus more on, let's get the diagnosis, let's treat the disease, and let's keep throwing more drugs or surgery at things. Because in the United States, we take, in some studies that I've seen, 4 times more medications than any other country, and we're operated on almost 3 times more than anyone else. So it's like, it's not working. And so I think not only in the United States, but in Europe, you're going to see it worldwide. I was talking to the doctor in the Philippines, and he's got 21 hospitals that he wants to have a compounding pharmacy and do peptides. And then they're going to harvest birth tissue and have their own stem cells right there in the hospital. And that will be the frontline medicine. And they're like, we want you to help us set this up in all 21 hospitals. And I'm like, I've got plenty of time to do that, so I'll be right there. But I'm helping them best I can. But I'm just telling you guys, like, this massive transformation is coming, and you guys are at the forefront of it. And appreciate you guys putting your trust in us, and really appreciate the cool questions you ask. And then for those of you who come to a retreat, make sure you come back. It was so good to see you. You guys know who you are. And then for those of you who are coming next month, can't wait to see you. I mean, actually next week we have one, and then 2 weeks after that. So anyway, we have some fun retreats coming up. So yeah, appreciate you guys.
Awesome. Well, thanks so much, Regan. That was like really cool to go through the protocol process. Hopefully everyone got some big wins there, and everyone have an amazing evening, and we will see you all next week.
Cool. Bye-bye.